Okay, now rule number 17, handovers. Now this was partly applied in the previous question, so let's read it together. Handovers should be, number 1, done in person, preferably over sending a message through another person or over the phone or leaving instructions in the patient's clinical record. So it's always preferable to do handovers in person. Number 2, directly communicated with the hospital or person that you're handing over the care of a patient to when possible. So let's look at the question. You are working on a surgical ward and are on your way to check the discharge of a post-op patient, Joanne, who is due to be transferred to a rehabilitation hospital. You have been advised by the ward manager that Joanne's bed is needed urgently for a newly arrived patient. When you arrive at Joanne's cubicle, her daughter, Ali, tells you that her mother has been complaining about her chest and is struggling with a cough. You review the observation chart and listen to Joanne's chest, which does not indicate a problem. Ali insists that her mother has a chest infection and should not be discharged. All right, so rank and order the appropriateness of the following actions in response to the situation. So the correct order is C, E, A, B, D. Now the most appropriate answer here is C. Advise Ali that you will delay the transfer in order to consult with a senior member of your team. Although you've examined the mother and you don't find a problem, but they insist that there is a chest infection, you still need to explore this. Perhaps because of your inexperience, this is a limitation, and hence you have to involve a senior member of your team before discharging patient from your care. So the patient needs to be medically fit before they're discharged, and again, that would put patient safety your biggest priority. Now the rest of the answers are about handover. So if you look at the rest of the answers, let's look at E. Contact the rehab hospital and write detailed notes outlining Joanne's symptoms and possible investigations to send with her. So she's still going to a hospital and you want to transfer her care to another hospital. Here you're contacting the rehab hospital yourself. It's a direct communication as well as writing detailed notes, just so that there's another way of giving the handover. Now this is over A, which is ask the ward nurse to inform the rehab hospital that Joanne's condition needs assessing on arrival. You are handing over your responsibility to a patient so that they can contact and communicate with the hospital. So rule number 17 said you need to directly communicate your handover. Now, B and D. D is very obviously inappropriate because you're disregarding Ali and her mother and doing nothing about it and advising them that there is an urgent need to discharge her mother to create space on the ward. That is completely inappropriate, so that's the last option. Now, looking at B, look at it independently, right? So we are always looking at options independently. You're informing Ali that she should insist on a further review of Joanne's condition when she arrives at the rehab hospital. So here you haven't done anything. You haven't handed over the care that you should have done to the hospital. You haven't involved a senior colleague. All you're telling the patient and her daughter is that you can go ahead and tell your concerns to the next hospital, and that is not appropriate. This is the rationale.